Welcome to day 6 of our bootcamp series. Today we are tackling the climbing net. In this session, we are going to reinforce your documentation skills, tighten gaps, and make sure your records are strong enough to support every bill. So let's climb our way to accurate and complete medical documentation, hopefully without slipping through the holes. The learning objectives for today focus on the goals, legislative intent, and treatment guidelines of the Texas Workers' Compensation System, applying standards for accurate and compliant medical documentation, and understanding the process for monitoring benefits and delivery of healthcare quality. In this presentation, we'll talk about the key guidelines and best practices you need to know to navigate the unique requirements of the Texas Workers' Compensation System. Accurate and compliant documentation isn't just a formality. It's the backbone of effective patient care, proper billing, and keeping yourself legally protected. We emphasize in all of our educational presentations that our main goal is to inform and educate you. This presentation is for educational purposes only and provides general information to help you navigate the system. It's important to remember that it's ultimately your responsibility to understand and follow the relevant statutes and rules, because these laws and regulations play a key role in resolving disputes and complaints. So I encourage you to familiarize yourself with the Texas Insurance Code, the Texas Labor Code, and the Texas Administrative Code. Today, we will be discussing the goals and legislative intent of the Texas Workers' Compensation System, general standards for medical documentation, documentation related to a workers' compensation claim for benefits. We'll go over treatment guidelines, documentation supporting billed charges, and monitoring the delivery of medical benefits and quality of healthcare. Let's start by talking about what Texas Workers' Compensation is really all about. The goal of the system is simple: to make sure injured workers get the care they need when they need it, while keeping things fair for providers and employers. The Texas Workers' Compensation System is all about keeping things running smoothly. It's designed to make sure injured employees get prompt, quality medical care so they can heal, and when they're ready, get back to work. The return to work process is meant to be safe and collaborative, making sure employees only get back when it's truly appropriate. Plus, the system works hard to keep disputes to a minimum and handle them fairly and quickly when they do come up. The system is all about making sure everyone plays by the rules to keep things fair for everyone: workers, employers, healthcare providers, and insurers. It's also there to help people understand their rights and responsibilities, making it easier for everyone to work together. With clear rules and good communication, the focus stays on helping injured workers recover and get back to their jobs in a safe and effective way. Now that we've gone over the goals and the intent of the Texas Workers' Compensation System, let's switch gears and talk about some best practices and general standards for medical documentation. A well-documented medical record does more than track a patient's history. Well-maintained records help avoid delays and reduce questions, and they also streamline the billing process for all parties. On top of that, your documentation serves as legal evidence, verifying the care and services that you provided. If your care is ever questioned, those records are what will back you up and validate your work. As CMS reminds us with their often quoted line, "If you didn't document it, it's the same as if you didn't do it." This underscores how vital good documentation is, not just for the injured employee's care, but also making sure your efforts are recognized and supported when it matters most. The Texas Department of Insurance follows CMS standards to bring consistency and fairness to the workers' compensation system. By using Medicare reimbursement methods and policies, it creates a standard for billing, coding, and reporting that everyone can stick to. The Commissioner has adopted current CMS policies keeping Texas workers' compensation practices in line with nationally recognized standards. This approach makes life easier for everyone involved. It simplifies processes, improves transparency, and helps cut down on errors and disputes. Medical records need to check a few key boxes. They must be complete, easy to read, dated, and signed by the provider. These elements confirm that the provider takes responsibility for the record and ensures its credibility. Your documentation also has to back up the services you billed for. It should match the codes and charges you submit. In short, every entry needs to be accurate, properly signed, and meet reimbursement requirements. For more details on general documentation guidelines, you can check out the link below for our Medicare administrative contractor, which is Novitas Solutions. Medical documentation covers a lot more than just visit notes. It includes evaluation reports, narrative reports, assessments, progress notes, hospital records, and even diagnostic test results. Section 133.210 of the Texas Administrative Code spells out these requirements, which apply to every service provided for an injured employee. Keeping detailed and accurate records ensures that every part of the patient's care is documented and ready for review whenever it's needed. It's all about creating a complete picture of the injured employee's treatment journey. In the workers' compensation system, most standard documentation rules still apply, but Rule 133.210 adds a few extra requirements. Providers need to make sure all required documentation is legible and submitted with the medical bill, unless it's already been provided to the insurance carrier. This rule covers specific documentation needs for non-network services, like high-level evaluation and management services, surgeries over $500, and procedures without an established reimbursement rate. These are just a few examples, so it's a good idea to review the rule to ensure your documentation meets the specific requirements for the services that you're billing for. For network services, the requirements will depend on your contract with the network. Take the time to check that contract and confirm that you are meeting their documentation standards too. I just want to point out that networks may decrease documentation requirements, so it's important to stay on top of these details to maintain compliance and avoid potential issues down the road. Now let's talk about some common mistakes we often see. One big one is overusing the copy and paste function, which is also known as cloning or cookie cutter documentation. Yes, it can save time and make documenting more efficient, but if you're not careful, it can lead to errors that hurt the accuracy and reliability of your records. To avoid issues, it's important to use this tool thoughtfully and make sure every note you create reflects the unique details of the patient's care. That way, your documentation stays accurate, supports quality care, and holds up to any scrutiny. Using the copy and paste function in electronic health records, otherwise known as EHRs, can definitely be a time saver, but it comes with some risks that you need to watch out for. Copying outdated or irrelevant information might make your documentation inaccurate and fail to reflect the patient's current condition. In some cases, it could even lead to allegations of fraud if the services are later disputed. Another common risk is accidentally copying information into the wrong patient's record, which can create serious errors. To avoid these issues, take the time to review and verify that all entries are accurate, up to date, and specific to the patient's current visit. It's a simple step that protects both you and your patients while keeping your documentation solid and trustworthy. Authenticating the services you provide and order is a key part of accurate documentation. Every single entry in a patient's record needs to include a clear, legible signature, whether it's handwritten or electronic. Your signature isn't just a formality. It confirms who's responsible for the service and serves as proof that the care documented actually happened. Signatures also have a regulatory purpose. Per CMS, they're often required by laws, rules, or coverage policies to demonstrate the authenticity of the record. By ensuring every entry is properly signed, you help maintain the integrity of the medical record, prevent fraud, and protect yourself and your practice. In Texas workers' compensation cases, signature requirements are key to making sure medical documentation and billing are valid. Physicians and suppliers need to include their signature, their credentials, and the date on all medical bills to confirm accuracy and verify their identity. For certain forms, like the DWC 69 Report of Medical Evaluation, certifying doctors are allowed to use a rubber stamp or electronic version of their personal signature. And remember, best practice is always sign your notes or orders right after completing them. Any changes you make should be clearly identified as either an amendment, a correction, or a delayed entry. This helps identify them from the original content, keeping your notes transparent and avoids confusion during reviews or audits. An amendment is used to add missing information to a record without changing the original entry. A correction is made when an error needs to be fixed, with a clear note explaining the change. And a delayed entry is added when relevant information that wasn't available at the time of the original note, but is now necessary for completeness, needs to be added. You want to make sure you never delete the original content. Instead, clearly separate it from the updated information so it's easy to see what's changed. Under Texas Medical Board rules, it's essential to clearly indicate any changes made after the original encounter. Each update should include the date and time it was made, along with a note explaining the change. This keeps the record transparent and avoids any confusion during audits, reviews, or legal proceedings. So that covers the basics and best practices for medical documentation. Next, we'll talk about the specific documentation requirements for workers' compensation claims related to medical benefits. When documenting medical services, it's important to show that treatments meet specific criteria to be presumed reasonable. You want to be sure that the services you bill for align with established medical policies and guidelines. This adds credibility to your documentation. If a service is approved through utilization review, don't forget to include all the key details. This means adding the authorization number, the approval date, and any specific instructions from the carrier. When documenting medical care, it's essential to base your records on evidence-based principles. Reference clinical studies, establish guidelines or protocols to back up the treatment plan, and take the time to explain the scientific reasoning behind the care that you're providing. Make sure to include measurable goals that show how the treatment supports the patient's recovery or helps them get back to work. Most importantly, confirm that your documentation justifies the medical necessity of the care, avoiding anything that's unnecessary. By sticking to these practices, you validate the care you provide and help support positive outcomes for the injured worker. Accurate billing starts with using the most current Level 1 CPT and Level 2 HCPCS codes, which are updated regularly. When choosing a billing code, make sure it matches the exact service provided and that your documentation clearly supports it. The codes you select should accurately reflect the care you've given, backed by evidence of medical necessity and details about the scope of care in your records. Staying on top of accurate and up-to-date coding helps streamline the claims process. When selecting the right CPT code for evaluation and management services, you have options to consider. You can choose by medical decision-making or MDM, or total time. MDM represents how complex it is to diagnose or manage the patient's condition, and your documentation needs to clearly support this. The other option is to base the E&M code on total time you spent providing care during the encounter. Either way, accurate documentation is essential to back up the level of service that you're billing for. If the level of service is ever questioned, your notes will be what gets reviewed and audited to confirm if the correct code was selected. If you're selecting codes based on total time, this table shows the required time thresholds for new and established office patient visits. These thresholds come straight from the E&M guidelines in the CPT codebook. To ensure accurate code selection, make sure your documentation clearly aligns with these time criteria. It's all about matching the time spent with the right code to keep your billing accurate. Medical decision-making is perhaps one of the most important components of E&M code selection. When choosing a level of E&M services based on MDM, there are three main elements to consider. First, look at the number and complexity of problems addressed, ranging from straightforward issues to multiple complicated chronic conditions. Second, document the details of any labs, imaging, or external records you reviewed, as well as any consultations or with other healthcare professionals. Finally, consider the risks involved in managing the patient, like procedures, treatments, or potential complications. Your documentation should clearly reflect these elements to support the MDM level that you've chosen. The record should match the complexity of the care that you've provided. We do receive calls from providers in Comp Connection requesting us to help determine a code for services rendered, but we are unable to advise on that since we don't have the full picture of what was actually done. Your code selection should always be based on the medical record relating to that visit. This chart here, provided by the AMA, breaks down the components of medical decision-making. This chart is very useful for helping you accurately categorize your documentation to match the services you provided. This is what we use to audit documentation submitted for medical fee disputes to verify that correct codes were selected. Understanding how to use this chart is essential for ensuring your documentation fully supports the code that you bill. For your reference, I have included this as a full-page handout that came along with your login instruction email. So if you didn't check that out, you do have this form available. I'm going to give you a basic overview of this form, and I've broken it down into three key components, starting with the first section, the number and complexity of problems addressed. E&M guidelines categorize patient issues into 4 levels: minimal, low, moderate, and high. Minimal problems are minor and self-limiting. You can think of these things like a cold that resolves on its own. Low-level issues include stable chronic conditions or acute uncomplicated problems like controlled hypertension or a simple sprain. Moderate and high levels are where things get more serious. These include chronic illnesses with exacerbations, undiagnosed problems with uncertain outcomes, or conditions and injuries that pose significant risks to life or bodily function. The number of diagnoses and/or management options is based on the relative level of difficulty in determining a diagnosis and/or the status of a problem. It's all about capturing the complexity of what you're managing to ensure accurate documentation and coding. The next component is the amount and complexity of data reviewed and analyzed, which reflects how much information you used to manage a patient's care. The amount and/or complexity of data for review is measured by the need to order and review tests and the need to gather information in data. For minimal data, it might be something simple like reviewing one test result or gathering information from someone other than the patient, such as a caregiver or another individual, and on the form they're referred to as independent historians. For limited data, you will need 2 unique pieces of information, like reviewing 2 different tests or combining one test with additional details from an independent historian. When it comes to moderate or extensive data, things get more detailed. You'll need to meet specific combinations of information, such as reviewing 3 different tests, documents, or other data. Keep in mind, each category of tests or documents you order, review, or analyze counts towards this section. So make sure that you capture all of this information in your documentation. The last component on this form is risk, which is determined by the physician's assessment of the likelihood that the patient could become more ill, develop complications, or face other serious outcomes before the next visit. The risk level, minimal, low, moderate, or high, is based on the potential severity of the condition or the recommended treatment. Risk indications include the nature of the presenting problem, the urgency of the visit, comorbid conditions, and the need for diagnostic tests or surgery. It's crucial to understand how your documentation translates into this form. It helps verify that your notes meet the requirements for the CPT code billed for the services that you provided. Making sure your documentation aligns with the level of risk ensures the selected code is supported and compliant. All right, now that we've covered this audit form and its role, let's move on to a couple of the required forms specifically for workers' compensation claims. These forms are used to document medical services, and we'll take a closer look at those. An essential communication tool in workers' compensation cases is the DWC 73 form, known as the Work Status Report. This form is used to inform the insurance carrier, the employer, and the injured employee about the worker's functional abilities. It helps determine whether the employee can return to work with or without restrictions, or if they are unable to work at all. When completing the DWC 73 form, whether as the doctor or a delegated physician assistant or APRN, it's crucial to clearly document the injured employee's work status. Specify if the employee can work without restrictions, whether they need specific limitations or if they cannot work at all. Be sure to include a detailed explanation of how the injury or condition affects their ability to work. Avoid vague statements like having surgery soon, and instead focus on specific details about how the injury limits their work activities. If the employee's restrictions change, explain how their capacity to work has expanded or shifted compared to previous limitations. You can also use the MD guidelines as a resource. They provide evidence-based recommendations to ensure compliance when documenting work status and restrictions. And we'll talk about those just a little bit further into the presentation. Another common example of insufficient documentation is simply writing pain as the reason an injured employee cannot work. On the DWC 73 form, Box 13C is where you enter the employee's work status information, and it's a critical part of the form. This section is closely reviewed during performance-based oversight reviews to ensure healthcare providers are staying compliant. Instead of just writing pain, document the specific injury and explain exactly how the condition impacts the employee's ability to do their job or limits their activities at the work site. For example, describe how the injury affects their mobility, their strength, or their ability to perform specific tasks. Explain the reason and give a rationale of what prevents the injured employee from being able to work. Clear and detailed explanations are needed to justify the work restrictions and support your conclusions. These details help provide the necessary justification for the injured employee's status. This example here shows a compliant example for a reason the injured employee is unable to work. As you can see, this explanation gives context surrounding the injury along with a descriptive rationale. By stating post-operative right shoulder surgery on medication that prevents driving and or operating heavy machines or lifting, open wound protection, limited medical rest needed. This is much more descriptive and detailed and provides the necessary details as to why the injured employee is unable to work. The next form that is most commonly used is the DWC 69 form, known as a report of medical evaluation. This form is used to certify maximum medical improvement and assess permanent full body impairment as outlined in Texas Administrative Code 130.1. Only specially trained doctors, such as treating doctors, doctors referred by treating doctors, designated doctors, or required medical examination doctors can complete this form when an impairment rating is involved. Physician assistants or APRNs are not allowed to complete the DWC 69 form since they don't meet our definition of doctor. However, if a treating doctor determines that an injured employee has no potential for impairment, they are able to certify MMI without special training and can fill out the form with the MMI date. In these cases, no narrative report is required. Clear and detailed documentation on this form ensures proper handling of the claim, and it helps guide the next steps for the injured employee, whether that's returning to work, continuing treatment, or addressing any impairment-related needs. When completing the DWC 69 form, there are two key steps that you need to follow. First, the certifying doctor must sign the form, which can be done with a rubber stamp or an electronic copy of their personal signature. This again ensures the form is authenticated. Second, include a detailed narrative report that explains the medical reasoning behind the MMI certification and impairment determination. This report provides the context and justification needed to support the decisions documented on the form. When preparing the narrative report to go along with the DWC 69 form, it's important to include detailed information that gives a complete picture of the case. First, state the date of the certifying examination. This sets the timeline for the evaluation. Second, document the date of maximum medical improvement to mark when the employee's recovery stabilized. Next, include comprehensive findings from the certifying examination. Be sure to detail all observations and conclusions to support the MMI determination. Finally, provide a clear history of the medical condition, outlining how the injury progressed and what treatments were provided. This approach helps ensure that the report fully supports the care that was provided. When documenting the injured employee's current clinical and functional status during the certifying examination, be as clear and detailed as possible. Start by stating the diagnosis and including clinical findings that support the determination of any permanent impairment. It's also important to specify the addition of the AMA guides you use to assign the impairment rating. Currently, we are using the 4th edition. Including this information ensures consistency with these guidelines. Also, I want to point out that there's a narrative report and form requirements document available at the link below on this slide. It's located on our designated doctor page, but the information applies to any authorized doctor completing an impairment rating and the required narrative report. If that is something that you're working on or something you'd like to look into a little bit more, definitely check that out if you want more information on preparing one. So now we've gone over the narrative report requirements. Let's talk about some of the common deficiencies we've seen during reviews. You'll see that the administrative code is next to each of these errors for easy reference. One big issue that we see is missing key details like the injured employee's current clinical status, the diagnosis, or the clinical findings that support a permanent impairment rating. Another frequent problem is the lack of specific findings from the certifying examination or clear explanations of how clinical findings tie into the impairment rating. This even applies to 0% ratings, which indicate no measurable permanent impairment after calculation. It's important to note here that a 0% impairment rating isn't the same as no impairment at all. No impairment means the treating doctor determined there was no need for calculation because there was no possibility of impairment that existed from the injury. Additionally, if certain measurements couldn't be obtained, be sure and explain why. Thoroughly documenting these elements ensures your narrative report is complete and accurate with regulatory standards. Before finalizing your report, take a moment to review these requirements to make sure everything is in order and meets compliance standards. All right, next, let's talk about the most commonly used guidelines that we use, which are the ODG and MD guidelines. These are commercially available subscriptions, meaning that they require a paid subscription to access them. These help provide evidence-based recommendations for treatment, recovery timelines, and return to work planning. The official disability guidelines, known as the ODG, are evidence-based resources that help ensure treatments for workplace injuries are reasonable and necessary. These guidelines cover everything from therapies and procedures to surgeries and diagnostic tests, and they apply to almost all workers' compensation claims. Using ODG helps you align treatment plans with best practices, making the approval process smoother and reducing the need for exceptions. If you need pre-authorization, you can reference specific ODG sections, like attaching a PDF or guideline excerpts that can help support medical necessity and strengthen your case. It's an easy way to strengthen treatment decisions with solid evidence. I took the liberty here to show you where this is located in the ODG. If you ever get into it to see, this is where you would be finding this information. When deciding on treatment, it's important to refer to evidence-based guidelines like ODG or network treatment policies, which helps show that care is reasonable and necessary. But if a treatment isn't covered by these guidelines, that doesn't mean it's not justified. You can still support medical necessity by referencing credible, evidence-based literature. Proper documentation of these sources not only backs up your decisions, but also strengthens your rationale, making it easier to justify the care provided. ODG guidelines provide useful guidance for treatment decisions and reimbursement, but they aren't absolute rules. Every patient has unique clinical needs, and in some cases, they may require care beyond what's outlined. When this happens, detailed documentation is key. You want to cite medical literature highlighting proven outcomes or include other supporting details. Providers and insurance carriers can also agree on evidence-based treatment plans to help justify the recommended care. This helps strengthen your rationale, and it makes it easier to defend your treatment decisions as well. When you need to request an exception to ODG guidelines, clearly justify the treatment in both the medical records and pre-authorization requests. One effective strategy is to copy and paste relevant sections from the ODG guidelines directly into your documentation to support your rationale, to support your rationale, but make sure that you always tailor them to the specific patient to avoid copy and paste errors that we discussed earlier. If a treatment is labeled as not recommended, explain why it's necessary, whether that's due to a rare condition, an unusual case, or ongoing chronic care, and provide detailed case-specific documentation showing how it will lead to meaningful, lasting improvement. To justify a treatment exception, include key details that strengthen your request. Document any relevant comorbidities that could impact treatment decisions, and highlight objective signs of functional improvement from prior treatments. And outline measurable goals like returning to work to show how additional care will help the patient reach those outcomes. For chronic conditions, explain how the care plan will gradually reduce treatment needs over time, and reference credible studies or guidelines to back up your recommendation. A well-documented, evidence-based request shows that the treatment is necessary and focused on real patient progress. The stronger the justification, the better the chances of approval when it comes to exceptions. When documenting return to work activities and setting recovery timelines, MD guidelines is another resource that provides an evidence-based way to make informed decisions. These guidelines are built on clinical research and real-world data, helping set realistic recovery goals for injured employees. Use them whenever you're determining work restrictions, recovery timelines, or treatment plans to ensure consistency. They also strengthen documentation by providing a clear, evidence-backed rationale for treatment durations and return to work recommendations. To use MD guidelines effectively, start by looking up the condition or injury to find typical recovery timelines and work restrictions recommendations. Then compare these guidelines with the patient's specific situation, taking into account comorbidities, job demands, and overall progress. This approach helps create a personalized, evidence-based return to work plan that aligns with medical best practices while supporting the patient's recovery needs. All right, so that covers treatment guidelines. Now let's focus on how documentation supports billed charges in workers' compensation. This section outlines key components practitioners must include to justify their services. It's important to understand the difference between shall and should in legal and regulatory language. When you look up the rules and laws from your individual licensing boards, knowing the difference helps you stay on the right track. Shall indicates a mandatory action that must be performed with no exceptions. Should refers to a recommended action that should generally be followed, but deviations must be supported by sound medical judgment and clearly documented. You can think of it like this. Shall is the bossy older sibling, and should is the helpful friend giving good advice. Knowing this distinction can save you a lot of trouble when you're navigating the rules. All doctors licensed by the Texas Medical Board have to follow the rules laid out in the Texas Administrative Code 22. An important rule is to keep in mind is that medical records need to be complete, up to date, and easy to read. Good documentation isn't just a box to check. It's key for providing great patient care and staying on the right side of the rules. When it comes to documenting patient care, there are a few key things every practitioner should include to cover all the bases. Start with why the patient came in. What brought them to your office that day? Be sure to capture their history, your exam findings, and any diagnosis or assessment that you've made. Don't forget the care plan. It should reflect what you're doing for the patient on that specific day. And of course, always make sure it's clear which doctor provided the services. If adding any late entries, always make sure to include the date, the time, and the identity of the person who made the entry. These details aren't just important for the record, they're what help tell the full story of the patient's visit. Past and current diagnoses should be easy to spot so anyone reviewing the record knows what's going on. Document all communications and make it clear why tests were ordered, what the results showed, and how these results shaped your next steps. Tracking progress and how the patient responds to the treatment, and even noting any non-compliance helps provide a full view of their care. Make sure to thoroughly document any requests from other providers and any records that you review. By simply just creating a list of those records, that may not be enough. Take the time to explain your analysis and how the information that you went through impacts your decision-making. Don't forget to include risk factors. They provide important context and demonstrate a proactive approach to the patient's care. If you need to make amendments or corrections, always retain the original text while clearly noting the date and author of that change. For workers' compensation visits, it's crucial to document how and why the injury happened during work activities. Consider whether the incident was a substantial factor, meaning did it significantly contribute to the injury, or would it have happened anyway? This is where the legal concept of but for applies, meaning the injury wouldn't have occurred but for the work-related event. Ideally, this should be recorded within the first or second visit while details are still fresh. Include specifics, what led to the injury, when and where it happened, and use the employee's own description in their words. Support this with objective details, like scene descriptions and physical exam findings to strengthen the claim. Your conclusions should be based on solid evidence, using clinical guidelines, studies, or established best practices to support your analysis. Well-documented, clear, and detailed records help establish the connection between the injury, the incident, and medical necessity, making your case both logical and defensible. Okay, so that summarizes some of the best practices for workers' compensation medical documentation. In this last section of the presentation, we're going to take a closer look at the Office of the Medical Advisor and how we monitor the delivery of medical benefits and quality of care. The medical advisor is vital to ensuring quality healthcare for injured employees in the Texas workers' compensation system. They help implement healthcare-related provisions of the labor code, review complaints about care quality, and recommend sanctions when needed. Additionally, they oversee the medical quality review process and lead the medical quality review panel, otherwise known as MQRP. These efforts support accountability and maintain high medical care standards. The medical quality review panel evaluates the actions of key participants in the workers' compensation system, such as doctors, healthcare providers, insurance carriers, utilization review agents, and independent review organizations. Their role promotes accountability and confirms that all parties comply with established quality care standards in care and decision-making. Medical quality review verifies that healthcare provided is medically necessary, delivered in a timely manner, stays cost-effective, and supports functional recovery to help injured employees return to work appropriately. Medical case review can be initiated based on a complaint as part of a plan-based audit or through monitoring required by a consent order. A consent order resolves a dispute or addresses noncompliance without going through a formal hearing or litigation process. It may include ongoing monitoring to ensure corrective actions are implemented and maintained. These review processes help uphold accountability and maintain standards within the workers' compensation system. This year's audit plan focuses on the same key areas that we've covered in this presentation, ensuring accurate and compliant medical documentation. The audit will specifically review designated doctors in the workers' compensation system to verify that their records meet standards for clarity, thoroughness, and compliance. This helps reinforce accountability and maintain quality care while ensuring medical benefits are properly delivered to injured employees. Strong documentation supports the integrity of the system and the effective delivery of medical benefits to injured employees. Everything that we've talked about in this presentation today can be found on these next two slides here that I included in the slide deck that went along with your login email. They provide key links to key laws and resources that help guide documentation in workers' compensation. You could think of these as a toolbox to help you understand the rules and help you improve patient care. I hope you take some time to review these resources because they provide a lot of information that can be helpful when it comes to navigating workers' compensation cases. Okay, so let's go over and recap what we've talked about today. We talked about the goals and legislative intent of the Texas workers' compensation system. We went over general standards and best practices for medical documentation, documentation related to workers' compensation claim for benefits. We talked about treatment guidelines, We went over documentation supporting billed charges, and then we discussed the monitoring, the delivery of medical benefits, and the quality of healthcare. So we are at the fun part of these webinars, which is the train your brain and let's flex your knowledge section. In this portion, what we do is we put up a poll. Hopefully all of you will contribute to and answer these questions. The first question was, to achieve standardization, DWC's commissioner adopted the most current CMS policies relating to billing, coding, and reporting. The answer to that is true. We do adopt the most current CMS policies that relate to that to keep it all on an even playing field and make sure everybody's stays on the same page. Number 2, a healthcare provider selects the appropriate CPT code level for E&M services based on total time or medical decision making. I was hoping everyone was going to get this one right, but again, that one is true. Providers can select their level either by total time spent or by medical decision making. Number 3, as a best practice, any amendment, supplementation, change, or correction in a medical record not made at the time of the encounter must be clearly noted and include the date and time. Everyone got this correct. You're right, that is true. Number 4, the Medical Quality Review Panel helps promote accountability and confirms that all parties comply with established quality standards. Again, everyone got that right? That is true. And number 5, the official disability guidelines are used as an evidence-based resource to help guide treatment decisions in Texas workers' compensation non-network cases. The answer to that is true. I did try to trick all of you by making them true, but the answer to that is true. The official disability guidelines are used as an evidence-based resource to help guide treatment decisions. Thank you so much for participating in that. All right. Next time, in our next boot camp session, we will be tackling networks, one foothold at a time on the climbing wall. And just like navigating a complex obstacle course, understanding networks require strategy, grip, and a solid foundation. This is where you will learn what a certified workers' compensation healthcare network is, how to find networks in your area, and how to become a network provider, and understand the importance of intake in identifying network status of the injury. As always, if you have any questions, you can always contact us at CommConnection by email or phone. We are always happy to help with anything that you need. Thank you so much for joining us today.